that's what led us down that road.
So basically, he tried it on himself, and he realized, hey, if it helped me, it can help other people.
Oh, absolutely. Yeah, we saw when it worked. We saw how good it worked for him. You know, I had it done on my shoulder. I got cut playing basketball way back in college, and have had trouble with my shoulder issues for years. And so I got my shoulder injected, and I don't have any pain or any problems with it anymore. And so it's just we just seen it be so effective. And you know, obviously we tested out on our family members first. We kind of did, and we were kind of solidifying our protocols for exactly how we wanted to do it, and just everybody had great results, and that's been the beauty of it so far. So that's kind of how most things that we end up doing in the office. Usually we've done something. We definitely experimented on ourselves first, make sure to see the results are what everybody claims they are, and then we're getting the outcomes that we expect. And that's what we've seen, and that led us down the road to continue to provide it for patients and to begin to make a difference in other people's lives and how it can help them